So first, could I ask the Chief Executive, Stephen Mulvany, to give an update?
Thanks, Mark. Afternoon, everybody. So firstly, briefly, just to look at the current situation and the outlook for the next 10, 12, 14 weeks or so. So in summary, the epidemiological and operational key performance indicators indicate that certainly if we get to a worst case scenario, we have cause for concern. As you hear my colleagues say, while the RSV virus may have peaked at this stage, it's clear that COVID and influenza viruses are on the rise and will continue to rise further. Operationally, our emergency departments are very busy. We've seen over 1.3 million people this year. That's up about 95,000 or 8% on the same period in 2019. But critically, it's up about 15% in terms of the over 75s. Now, that cohort of patients are likely to be admitted more than the general population. So we've admitted this year to date about 336,000, so about 1 in 4, whereas in the over 75s, we admit about 1 in 2. And in terms of the admissions so far this year, nearly 3/4 of the extra admissions compared to the same period in 19 is that over 75 cohort, who will also stay longer in hospital because their needs are more complex. The data also indicates that those who have COVID, even when we adjust for age and other illnesses they may have, will typically stay up to twice as long as other patients. So all of that points to a significant pressure on the system, significant ED congestion. And we know that ED congestion, it is a symptom of a wider system imbalance. It's not caused by emergency departments, nor is it fixable largely within emergency departments. So what we can see is trolley waits at 8 a.m. up about 4% compared to 2019, and the use of surge beds up about 8%, and what we call DTOC or delayed transfers of care back up over 600, similar to, in some cases, above 2019 levels. So in terms of a longer term solution, we know that's about changing the size and the shape of the health service, i.e. increasing capacity. That's about more beds, more staff, and we're putting those in. About what we refer to as the shift left, which is moving to the lowest level of complexity and improving the level of integrated care. That's about better patient pathways, better process flow. And we know we're investing, for example, in the Enhanced Community Care Programme, which is over $250 million investment over a number of years. But for now, for the next 8, 10, 12, 14 weeks, our aim is more immediate. It's to protect patient experience, protect patient safety. And what we've said to our teams is we need to be able to all look back and say that everything that could have been done over this winter was done. We also know that we're challenged with considerable variation in terms of emergency department waiting time, key performance indicators on individual sites. This variation can't be readily explained by virtue of variation in the demand versus capacity of individual hospital sites and their community teams. So, for example, one of our measures is the 8 a.m. trolley count. One hospital year to date, that's Waterford University Hospital, has had 0 trolley waits. We've another 8 sites where they've had low levels of trolley waits, less than 8 year to date on average per day, sometimes quite significantly less than that. We've 17 other sites whose numbers are much poorer than that. If we take our backstop patient experience time target that nobody should wait over 24 hours for admission, we have 5 sites, again including Waterford University Hospital, Kilkenny, Connolly Hospital, Portiuncula, and CHI at Tala, where they've achieved that 100%. They've had no over 24-hour breaches this year to date, to the end of November. We've done our 10 sites where they've achieved that 97 to 99% of the time, and 14 other sites whose performance is poorer. This unfortunately points to evidence of variable levels of leadership impact, variable levels of management process effectiveness, and variable levels of the quality of clinical pathways and clinical collaboration. So what are we doing about this? In terms of the winter plan and our multi-year approach, we're investing substantially with the support of the Minister for Health and Government. This year's winter plan is an investment of €160 million and over 600 extra staff. So we're putting in more beds, more staff, and more supports. And we're focusing significantly on hospital avoidance, process flow within hospitals, and supporting discharge from hospital, minimizing that delayed transfer of care. And next year we'll bring forward a 3-year improvement plan. But again, for now, in terms of the immediate focus, particularly over the next 12, 14 weeks. It is about intensification of our operational management focus, basically management grip. We've advised our sites around 10 essential actions, which my colleagues will refer to, including having senior decision makers available and reviewing those whose length of stay is currently over 14 days. It is about differentiation. So recognizing that we have variable performance across different sites, we will focus on regular direct engagement and support to our hospital groups and our community healthcare organisations, particularly around individual sites whose numbers are the poorest. And we'll also aim to ensure that all providers, including general practitioners, nursing homes and home care providers, are engaged with and supported to work effectively together. If we ask, what can you do? What can the public do? Firstly, we can all stay at home if we're generally unwell. Secondly, we can seek advice or care, for example, through hse.e, the website, your local pharmacist, your local general practitioner, your out of hours GP service, your local injury unit, through trusted sources like those. If you're concerned that someone may be critically unwell or seriously unwell, you should always phone 999. And fourthly, and really importantly, get vaccinated. Get vaccinated for COVID and for flu, particularly if you're a member of a vulnerable group or if you're around vulnerable people. If you're a healthcare worker, the message is you really do need to get vaccinated. And we would also stress it is not too late to make a difference. Thank you. My colleagues will expand further.